Good afternoon, everybody, and thank you for once again joining us for one of our health talks. Today's topic is diabetes awareness, and we'll begin our conversation about diabetes and discussing what is diabetes. To go through our overview, our conversation will be discussing what is diabetes, what happens in the body, the prevalence of diabetes in the United States, and then taking a look at Bexar County itself. We'll talk about the two different types of diabetes, risk factors for type 2, because our focus will be on type 2 diabetes, the complications associated with uncontrolled diabetes, management of the disease to include diet, exercise, medication, and the follow-up that we as diabetics should have. And of course, then goal setting and how important that is in managing the diabetes. And of course, support systems that are available to individuals with prediabetes and diabetes itself. So you've been told you have diabetes or prediabetes. What does that mean? Well, there are a lot of different, very technical definitions of what diabetes is, what it does. And so to try and simplify things, we want to look at the root cause. Diabetes is a condition of too much sugar in the blood. It is the inability to take the sugar out of our bloodstream and put it where it needs to go. And where it actually needs to go in the human body is inside of the human blood cell, because that is where sugar is converted to energy. So sugar that does not get into the blood cell does not convert to energy, and therefore it builds up in the bloodstream and it causes destruction. So what happens when we eat food? Our food is broken down into 5 major macronutrients. Those macronutrients are carbohydrates or carbs, fats, proteins, vitamins, and minerals. And of course, the human body needs all of those macronutrients in order to maintain good health and to function appropriately. The thing we need to focus on as individuals with diabetes is carbohydrates, because when we consume and digest carbs, 100% of those carbs are converted to glucose, which is sugar, and conversion takes place in the body and then builds up in the bloodstream. So as we ingest our food and it is metabolized and broken down into glucose, it is then released into the bloodstream where the pancreas is supposed to release insulin. For individuals with diabetes or prediabetes, we don't release as much insulin as we are taking in or the body releases in glucose or sugar. Therefore, there is a deficit in the amount of energy that is produced because there is a deficit in the amount of insulin that is released. And so what does that actually mean? Well, the more carbs we take in, the more sugar that is released in the bloodstream. The more sugar in the bloodstream, the greater the need for insulin. The less insulin produced, the higher the blood sugars, which results in a higher hemoglobin A1C. The higher the blood sugar level, the more damage that is being caused to our organs. And of course, the higher those blood sugar levels are, the greater the cravings for carbs. So it becomes then a vicious cycle of high blood sugars, carb craving, metabolizing those carbs into sugar, and then it just continues. So what does that mean in regards to the number of diabetics there are in the United States? 2022 statistics indicated that there were approximately 39 million Americans that had diabetes. That's 12.7% of the US total population. Prior to COVID, diabetes was the 8th leading cause of death marking at approximately 103 million individuals that died from diabetes in 2020. Of those 39 million Americans diagnosed or having diabetes, only 30 million of them have been diagnosed, with another 9 million Americans walking around with diabetes that have either not been diagnosed or not been treated. Of the American senior population, those over the age of 65, 29.2% of those individuals, or approximately 16.5 million seniors, have been diagnosed or have diabetes and haven't been diagnosed. And of those individuals with diabetes, 90 to 95% of them are type 2 diabetics, with the remaining 5 to 10% being type 1 diabetics. The annual incidence of diagnosed diabetes in 2017 to 2018 was estimated at 18,200 individuals with type 1 diabetes and another 5,300 additional individuals with type 2 diabetes. In 2020, there was a prediction made about the year 2025, indicating that the prediction would be 1 in every 5 Americans would have diabetes. And guess what? We're at 2025, and the predictions have come true. In the United States today, 1 in every 5 people have diabetes, to include children. By the year 2020, the prediction is that 1 in every 3 people will have diabetes. Now, these are alarming statistics, and it shows an exponential growth in the number of people with this disease. But when we look at Bexar County, where we live, the numbers are astronomical. In Bexar County, their entire population shows 16% as diagnosed with diabetes, rather than the 12% US statistics. It is the 4th leading cause of death in Bexar County, right behind cancers, automobile accidents, and gunshot wounds. It is painful to say, but San Antonio, Texas is #1 in the United States for diabetic amputations. That means we have more people in San Antonio losing limbs due to complications of diabetes. Bexar County's death rate for diabetes is higher than that of all of Texas and the US overall. And it's also the highest among the 5 largest counties in Texas. Approximately 500,000 Texans are still walking around with diabetes that haven't been diagnosed yet. And we are seeing a higher incidence of diabetes in males than we are in females. So when we look at the ethnic breakdown in Bexar County for diabetes, 15.1% of Native Americans or Alaska Natives that reside in Bexar County have diabetes. Over 18% of our Hispanic population, 15% of our white population, an astronomical 20% of Blacks that live in Bexar County have been diagnosed with diabetes, and 10% of Asians living in Bexar County have also been identified as being diabetic. So as you can see, just looking at the statistics for Bexar County in 2024, we are the mecca of diabetes and diabetes complications. So when we talk about the types of diabetes, as implied a few moments ago, there's more than one type. Type 1 diabetes is an autoimmune disorder. What that means is something occurs in the body that causes a destruction of the function of the pancreas, or the ability to produce beta cells, which are necessary for the production of insulin. What that means in layman's term is a type 1 diabetic makes no insulin. A type 2 diabetic makes insulin, just not enough to sustain healthy blood sugar levels. What that means is that we take in more sugar than we're able to balance with insulin. Type 2 diabetes is hereditary. It is a genetic defect that has occurred due to alteration in our genes to survive in our environment. What that means is generations back, maybe 6, 7, even 8 generations back, our ancestors had genetic changes that allowed them to survive in the environment in which they lived. Just like there were other genetic changes. For example, individuals who lived closer to the sun had darker hair, darker skin, and darker eye color. And in the opposite, individuals who lived further away from the sun had lighter skin, lighter eye color, and lighter hair color. Those are changes that took place in our genetics based on the environment that we lived in. The air we breathed, the water we drank, the food we ate, the soil that our food was grown in, all of those had an effect on our genes, and that change or alteration left individuals with a defect. Diabetes being one of those genetic defects that has been passed down generation after generation. So an individual that carries the gene could have that gene remain quiet the entirety of their life and never become type 2 diabetic. And then there are others that, based on risk factors, activate that gene. One of the things that has been able to activate that gene is gestational diabetes, or the inability of a pregnant woman to produce enough insulin for herself and her unborn baby. That triggers that gene generally later on in life, beyond the childbearing years, where if mom had a condition of not being able to make enough insulin during her pregnancy, she may not be able to sustain the level of insulin production after the birth of her children, which means she becomes permanently diabetic. There are other things that can trigger that recessive gene, such as medications, steroids. Chronic use of high-dose steroids cause an elevation in the blood sugars, and those elevations can result in the pancreas's inability to continue to produce enough insulin to match the rise in the blood sugars. There are chemicals and other diseases that can also trigger that gene. Chemicals like toxins. Many of our Vietnam vets who were exposed to Agent Orange now have a defective gene, or the triggering of that defective gene, that prevents them to be able to produce enough insulin, leaving them with the disease as well. Other blood disorders, such as hypertension, high cholesterol, lupus, sickle cell anemia, hemophilia, and other blood disorders can also trigger the activation of that gene for diabetes. So when we talk about the risk factors for activating that gene, we have two different types of risk: modifiable risk and non-modifiable risk. The modifiable risks are those risks that we have the ability to change through diet, exercise, and medications. Inactivity can trigger the diabetes gene. That's leading a sedentary lifestyle. And a sedentary lifestyle can be defined as an individual who sits behind a desk all day long, doesn't get any exercise or move around, and goes from sitting behind the desk to sitting in a recliner all evening. And the only exercise they're getting is pushing the buttons on the remote for the television. Being overweight or obese can trigger that quiet gene. already having high blood pressure or high cholesterol can also activate that gene. And we have risk factors that we have no control over as well. Our age. As we grow older, we naturally have a decline in our hormone production because the need for those hormones should become less and less as we grow older. Insulin is a hormone. And if there is a natural decrease in the production of insulin, but not a natural decrease in the consumption of sugars, that creates a deficit, triggering that activation. As I explained earlier, your ethnicity and your race play a role in the prevalence of that gene in your family. And you can determine how much at risk you are for carrying the gene by looking at other family members, the history of diabetes in the family. If mom, dad, brother, sister, cousins, aunts, uncles, grandparents have diabetes, the likelihood of you carrying the gene becomes even greater. So what does that look like? This slide is a demonstration or a depiction of acanthosis nigricans. And acanthosis nigricans is a change in the texture and color of the skin due to the body's inability to properly utilize or metabolize sugars. It causes a discoloration in the skin. The skin is raised slightly and velvety soft. This discoloration isn't irritated, it doesn't itch, it doesn't burn, and there's really no other detection other than this change in the color of the skin. This acanthosis can be found on the back of the neck, along the jawline of the face, under the armpits, under the breasts, behind the elbows, behind the knees, and in the area of the groin. And this is an indication that the body is no longer properly using the sugar that is being taken in. They are now finding children in elementary school with acanthosis nigricans, which is an indication that the child is either pre-diabetic or diabetic. And so it is important that we are looking for these signs to determine whether or not the individual has diabetes. So what does everybody get all excited about when we have high blood sugars? Well, chronic high blood sugars can lead to chronic complications. These complications are blindness, kidney disease, nerve damage, amputations, heart attacks, strokes. And I want to bring your attention to one of the other chronic complications, Alzheimer's disease. Alzheimer's disease is now being referred to as type 3 diabetes. And it is a condition that they are now discovering is being exacerbated or made worse by high blood sugars. These high blood sugars damage the neuroreceptors in the brain, which affect memory and cognitive ability. And so, yes, an individual with uncontrolled diabetes can suffer from early onset Alzheimer's and dementia. Diabetes can also cause increased risk of some cancers and high infections because viruses, cancers, flus, bacterial infections all grow best in warm, dark, moist, sweet environments. And what is the body of an uncontrolled diabetic. Warm, dark, moist, and sweet. So we feed the infection. We are the walking petri dish of infection. By lowering the hemoglobin A1C by 1 full percentage point, you can decrease or cut your risk in half for these diabetic complications. So, how do we manage diabetes? How do we manage the blood sugars? Well, the management of diabetes includes a number of things and requires different aspects of care to include diet, exercise, medication, routine follow-up with our primary care physicians or endocrinologists, and setting and accomplishing specific goals. All of these are the aspects of managing the disease. So let's talk about diet. For an individual with diabetes, diet has a very, very important meaning. The food you eat can either be the safest and most powerful form of medicine, or it is your slowest form of poison. When we think about that for a moment, that's very impactful. If we take the time to think of what we're eating as being either our medicine, which is going to help our body, or our poison, which is going to destroy our body, we then have a different way of looking at what we eat. And so, what does the word diet mean? Or what is it that we think of when we hear that word? I used to say, just drop the T, because if I have to eat one more thing that tastes more like the plate it's put on than food, I just want to die. But for individuals with diabetes, we should use the word as an acronym. And that acronym stands for Doing Intelligent Eating Today. As an individual with diabetes, we have to think about what we're putting in our body, and we have to ask ourselves the question, is this my medicine or is this my poison? And we have to do this one meal at a time, one day at a time. Otherwise, things get derailed and we start to consume more poison than we do medicine. So, how should we eat to maintain a healthy blood sugar level? Individuals with diabetes have to do some very important things when it comes to our meals. One, they need to be timely. They need to be consistent. They need to be balanced. And individuals with diabetes should follow the diet mantra. That mantra is low carb, low fat, high fiber, high protein, and low sodium. What that means is for an individual with diabetes, the foods that we consume should be low in carbs. They should be low in fat. They should be high in fiber, high in protein, and low in sodium. And so as an individual with diabetes, we have to evaluate the foods we eat by knowing what's in them. So how do we do that? Well, we first of all have to recognize the fact that food is changed into glucose, and that glucose is the body's #1 source of fuel. But it's important to know that 100% of the carbohydrates that we digest, that turns to sugar. 50% of the protein that we take in will turn to sugar, but it does so in a very slow manner, which in general allows the body to make enough insulin to compensate for the amount of sugar in our proteins. And our fats, 5 to 10% of those are converted to sugar as well. But our main focus is going to be on those carbohydrates. And so dietary recommendations are that we have regular meals with the appropriate amount of calories. And we have a variety of foods to include our fiber and our starches. And we want our carb intake, or the metabolism of our carb, to be steady, meaning low and slow, rather than in large quantities that create spikes in the blood sugar. So the dietary recommendations are low fat, low cholesterol. What that means is we want to limit our red meats, such as beef and liver. We want to avoid shellfish, that's shrimp, crab, lobster, oysters, clams, mussels, and scallops. All of these shellfish are high in cholesterol. Oh, and I left out crawfish, those too. We want to avoid fried foods because fried foods are fried in bad oils. And of course, that contributes to high cholesterol and high fat storage. We want to avoid or eliminate frequent restaurant foods because you cannot control the preparation of restaurant foods. Therefore, you have no way of knowing if they're low carb, low fat, high fiber, high protein, and low sodium. We want to increase our white meats, such as chicken and fish. We want larger amounts of fiber, and fiber comes from our fresh fruits, fresh vegetables, whole grains, legumes. Fiber helps to block the digestion of some carbs. So the more fiber in a food, the less of the carbs that are converted to sugar in the bloodstream. We want to limit our alcohol consumption. And we want to eliminate trans fats, which are chemically altered fats. And we want to stop smoking. Those are the recommendations of the American Diabetes Association to help individuals with diabetes maintain low blood sugars and healthy lifestyles. So what are the ingredients that we need to avoid altogether? Any food made with white enriched flour. White enriched flour is high in starch and is rapidly converted to sugar in the bloodstream. So we want whole wheat or multi-grain or nut flours rather than white enriched flour. We want to eliminate hydrogenated or partially hydrogenated oils from our diet. And those are oils that turn solid at room temperature, such as Crisco, lard, bacon grease, coconut oil. And people say coconut oil. Coconut oil is great for the skin, great for the hair, but not great for the digestive system because, again, at room temperature, it turns solid. If it's solid at room temperature, it's at least semi-solid in the bloodstream. And of course, we want to eliminate sugars and high fructose corn syrup from our diet. So we want to remember when it comes to our source of foods, if it's white, we don't bite. But if it's wheat, we can eat. I'm making reference to things that are made with white flour, as well as things like white potatoes and white rice. When we talk about things made with white flour, that includes pastas, breads, gravies, the coatings that we put on our meats. All of those are going to be high in carbs. So to reduce the amount of carbs that we take in that convert to sugar, we want foods that are going to be high in fiber, like whole grain or multi-grain breads, sweet potatoes rather than white potatoes, because sweet potatoes contain a much higher content of fiber. We want vegetable pastas rather than white pasta. And rather than gravies, we want natural juices on our meats, and we want our meats to be lean cuts. So what does a healthy plate look like? Well, looking at a healthy plate, it should consist of half of the plate being vegetables, leafy green vegetables like spinach, artichokes, asparagus, broccoli, green beans, all of those foods that are low in carbs but high in fiber, vitamins, and minerals. Roughage, which helps the body in slowing the digestion of those carbs and eliminating some of those carbs through the body. We want 1/4 of our plate to be lean sources of protein, white poultry, white fleshy fish, lean beef, pork. We want to have tofu, eggs, edamame, mushrooms. Those are good sources of protein. And we only want about 2 tablespoons of fat. And 1/4 of our plate will be our carbohydrates. That's going to be your legumes, your whole grains, your starchy vegetables, fresh fruits. And when we talk about fruits, we want fruits that we eat the skin on. The exception to that would be grapes. Grapes are high in sugar. Bananas are high in sugar. We don't eat the peel of a banana. That tells us that's a food that's going to be high in sugar. We don't eat the rind of a watermelon. So that tells us we need to limit our watermelon consumption. Berries we eat whole, which consumes the seeds, and those seeds serve as fiber or roughage to help to stop the breakdown of carbohydrates into sugar. So things like strawberries, blueberries, blackberries, raspberries, acai berries are all very good for a diabetic, again, in moderation. So looking at the plate, you can see that we need to increase our vegetable intake and decrease our carb intake. We cut our calories and we cut our carbs when we control our portions. Did you know that the obesity rate in China doubled with the introduction of McDonald's? What does that tell you about the American diet? When we control the amount of food we take in, we help to control the amount of carbs, bad fats, and bad foods that we are the only people that eat from a 12 to a 13-inch plate. The rest of the world eats from a 10-inch plate, which we call a dessert plate. So when we reduce our plate size, that helps us to reduce our portions. We don't need supersized anything. Americans consume approximately 20 to 25% more food per meal than the body actually needs. So when we talk about meal plans, every person's dietary needs are going to be different. It may be based on allergies. There are people with food allergies. It may be based on dentation. Some people can't eat certain foods because they don't have the teeth. It may be a religious thing that certain foods are prohibited or required. It may be a preference or a texture thing for some people. So the point I'm trying to make here is that no single food plan is going to work for everybody. There's no magic pill, no magic button to push that's going to satisfy everybody's needs for nutrition. But no matter what the dietary goals are, You now have the information you need to make the right choices. You know that the foods we eat should be low carb, low fat, high fiber, high protein, and low sodium. And what's important is the quality and the total number of carbs that we take in. So when we talk about what else we need to do to manage diabetes, we have to look at exercise. The recommendations by the American Diabetes Association is that we adopt and maintain physical activity because that is crucial to managing the blood sugars and the overall health of individuals with diabetes and prediabetes. Recommendations and precautions regarding the type of activity you do are going to be individually characterized, meaning what you do to exercise is based on your health condition. And so your health status impacts what level of activity you're able to do. So what are the exercise recommendations? For an individual with diabetes, daily exercise, or at least no more than 2 days without exercise, is what is recommended to enhance insulin action, to reduce insulin resistance. Adults with type 2 diabetes should generally perform both aerobic and resistance training for optimal glycemic and overall health. Children and adolescents with type 2 diabetes should be encouraged to meet the same physical activity goals that's set for youth in general, meaning they should be active approximately 4 to 6 hours a day, every day. Unfortunately, in today's society, things are a little different than what they were for when I was a kid. When we finished our chores and our homework, we were told, go outside and play, jump rope, ride bikes, play basketball. You're going to be active, but you better be in the house when those street lights come on. And so the activity levels of our playing ball and riding bikes. They're sitting at home in front of the TV watching YouTube or Netflix, or they're in front of a computer, and they're not getting the exercise that the body needs. And on top of that, they're taking in unhealthy snacks. The average 8-year-old in America consumes 80% of what they eat in fast food, processed foods, and vending machine foods. Structured lifestyle interventions should include about 150 minutes of exercise per week. And dietary changes, eating the low carb, the low fat, the high fiber, and the high protein, and low sodium, can all result in a 5 to 7% weight loss. And that weight loss can be significant for individuals with type 2 diabetes. So when we talk about medications, they're important for the management of diabetes by helping to regulate the blood sugar levels. They also help to prevent or delay complications like heart disease, kidney disease, and insulin resistance. They work in a variety of ways, and they help the body to respond to insulin. Increasing insulin production is one of the things that some of these medications do. Some of them slow down carbohydrate absorption and reduce the amount of glucose that is being produced by the liver. And some of these medications are essential, like for people with type 1 diabetes, who have no insulin production, and therefore they must have insulin from an outside source. Medications are generally prescribed when diet and exercise and lifestyle changes aren't enough. And so it's important that you understand that being put on medications is not intended as a punishment, but as a help. And so how do medications help manage diabetes? Well, one, it helps to improve the glucose control. Two, it addresses insulin resistance. It helps to increase the insulin production of the individual. It reduces the liver glucose production. Our liver actually releases glycogen, which is a form of sugar, into the bloodstream when we don't eat, when we go long periods of time without food. You'd think that would be a good thing because that would provide energy to the body. And it is, except we can't control the amount of glycogen being released by the liver. And it does so based on how we've taught our body we're going to perform. Meaning if you're an individual that skips meals, goes long periods of time without eating, the liver thinks you're starving it, and therefore it releases more sugar into the bloodstream to help you produce energy so that you survive. But the liver and the pancreas don't communicate with one another, and the pancreas can't keep up with the amount of glycogen that is being released by the liver, which then causes an escalation in the blood sugar levels of the individual. By taking medications, they can also help to prevent complications by controlling the blood sugar levels, reducing the risk of long-term complications. And you may well know, aid in weight management. There are a number of medications now on the market that are called GLP-1s, and they are designed to reduce insulin resistance, reduce appetite, and help the individual to lose weight, which again then reduces the need for insulin. So what routine follow-up should a diabetic have? Well, a person with diabetes or prediabetes should be seen by their primary care physician at least once a quarter. That's once every 3 months. They need an annual eye exam once a year by an ophthalmologist, not an optometrist that prescribes glasses, but a physician that is specialized in eye disease. And therefore, they are looking at the back of the eye to make sure that there is not retinal damage or retinal bleeding, as well as cataract formation or glaucoma. Regular foot care is important for a diabetic to prevent amputations. A colonoscopy is required at the age of 45 and every 10 years after age 45 up to about age 75 or 80, unless otherwise instructed by a physician. For women, especially during childbearing years, pap smears and mammograms are recommended. The immunizations that are recommended for individuals with diabetes include COVID, flu, and that's high-dose flu vaccines, pneumonia, which is high dose as well, your tetanus, your shingles series, your measles, mumps, and rubella, if you have not attended school here in the United States. And all of these immunizations help diabetic to maintain stable blood sugars because it helps to prevent illness. And we automatically have a natural increase in our blood sugars when we become ill. Another routine follow-up for a diabetic is an annual kidney evaluation. And that evaluates the function of the kidneys, and that is done through a urinalysis and a blood test. A person with diabetes or prediabetes should be seen by a dentist no less than twice a year. And men should have their annual prostate exam and prostate screening, just as women have their annual pap smears and mammograms. So let's look at the hemoglobin A1C. What is a hemoglobin A1C? Well, the hemoglobin A1C is the measure of the percentage of the damaged or destroyed blood cells in the sample based on the amount of damage done by sugar. I'll try and explain that again. Sugar that doesn't get into the human blood cell to create energy actually can destroy the human blood cell. It prevents it from living to maturity. And the human blood cell reaches maturity at about 120 days. But with high levels of sugar, it causes the rupture of those blood cells, destroying them. So those cells die much quicker than 120 days. And the hemoglobin A1C is the percentage of those cells that have been destroyed by sugar. So what should the hemoglobin A1C be? Well, if you have diabetes, the goal is that your hemoglobin A1C be less than 7. A non-diabetic individual's hemoglobin A1C is somewhere between about 4 and 5. For pre-diabetics, we want the hemoglobin A1C to be less than 5.6. So looking at these numbers, you can tell what the average walk-around blood sugar is that results in those A1C percentages. So it's important that we know what the blood sugar should actually be at certain times of the day. And generally, we have an increase in the amount of sugar in the bloodstream when we eat. So what we want to do is measure what's happening in the body about 2 hours after we eat. That is when digestion has taken place and this metabolic process has already begun and is almost done. So when we first get up in the morning, before we've had anything to eat, the goal is for our blood sugars to be between 80 and 130. 2 hours after every meal, the goal is for the blood sugars to be between 140 and 180. Every meal. And at bedtime, the goal is for the blood sugars to be between 100 and 140. So we have to assess where we are with our blood sugars at different times of the day. Is it too low? Is it too high? Do we need to do some work in evaluating what we're eating at these meals, or what our blood sugars are like when we're ready to go to bed or when we get up in the morning? So the last phase of managing diabetes is setting goals. We didn't just wake up and one morning, whoa, we have the conditions of diabetes. This is a process. There were steps that were taken to get you where you are. And there have to be steps that are taken to get this disease under control. Goal setting is an important factor in managing diabetes because it provides a clear, structured approach to the care you're going to get, and it helps to improve your motivation. If you set a goal of losing 10 pounds in the next 90 days and you accomplish that goal, that's going to motivate you for the next goal. I'm going to now cut out sodas. And when you do that, then the next goal is I'm going to eliminate eating white rice and I'm going to start eating brown rice because it's healthier for me. And you set small goals that are SMART goals. And SMART is an acronym that we use for specific, measurable, achievable, relevant, and time-bound. We don't want to say, I'm going to set a goal of losing 100 pounds in the next 30 days. That's unhealthy and that's unreasonable. So by setting these SMART goals, it helps you to break down the complex tasks like blood sugar management or blood sugar monitoring, and it helps you to improve your eating habits. It helps prevent the feeling of being overwhelmed by this disease and all the things you have to do. You know, for most of us, diabetes manages us rather than we managing it. And so goal setting provides structure and clarity. It boosts your motivation. It increases your consistency in doing things. It helps to prevent the discouragement of trying to do everything all at once and being overwhelmed. And it improves your overall health outcomes. Studies have shown that effective goal setting can lead to a better clinical outcome, improved self-efficacy, and increased satisfaction with your diabetes management or your diabetes care. So we have to take baby steps towards managing this disease so that it doesn't manage us. So one of the things we want to do is eliminate alcohol, or at least limit the amount of alcohol that we consume. We have to limit our drinks to 1 per day for women and no more than 2 per day for men. And a drink is defined as either 4 ounces of wine or 1 12-ounce can of beer or 1.5 ounces, which is 1 shot of spirits. And no, you can't save up all week for the weekend. It's a done or none kind of situation. The other thing that is imperative in the management of any disease is to quit smoking. You want to eliminate cigarette smoking, and you have resources that are available to you. We have support systems that are here and available, and we want to make sure that everyone knows what those are, both locally and nationally. So for San Antonio, Health Texas Medical Group, we have Diabetes Help SA. UT Health Science Center has the Texas Diabetes Institute. There's Defeat Diabetes Foundation, the Texas Department of Health and State Health, and Health and Education and Nutrition by Methodist Healthcare Systems all provide education and support to diabetics. That would conclude our discussion on awareness of diabetes. And as kind of a special treat, I wanted to prepare something, since we're coming up on the holidays, that diabetics can enjoy. The holidays can be difficult for a diabetic because, you know, everybody's got all these parties and festivities going on, and there's always lots of food. And diabetics sometimes feel like, well, I can't have anything. Or if I do, I'm going to suffer the consequences of my own actions. So my suggestion is you prepare something that you can take to the festivities that you can have. And I'm going to provide you the recipe for what I'm making at the end of this presentation. So I'm going to go ahead then, address any additional questions, and then we'll go right to our food demo. Okay, so if you'll give me just a moment, I'm going to set up my camera so that you can see what I'm preparing here. And today I am preparing what is a pear pecan cheese ball. It's low carb, low fat, high fiber, high protein, and low sodium. So bear with me for just one moment and we'll get started. I'm going to set this camera up so that you can actually see what I'm preparing here. Can you guys see that? You're not going to be able to see my face, of course, because it's more important that you see the ingredients that I'm preparing here so that you know what to do to make this cheese ball. Now, it's really very, very simple. What we have is one packet or box of low-fat Philadelphia cream cheese. And we're going to, I cut this up in cubes so it's easier to spread. And I'm going to move this salt out of the way so you guys can see that. Okay, so we have one packet of Philadelphia cream cheese, and that's been cut up into cubes. We're going to add that whole thing. Now, I take this out before preparing the cheese ball so it can soften. Okay, and then we take one firm ripe pear. I'm showing you this one because I've already got mine pre-diced and it's all cut up, and we do use the skin. That skin provides additional fiber. Before I go any further, I'm going to put my gloves on here so I don't make a mess. So we've got one diced pear. And that makes about, when you dice it up, it comes to about a cup and maybe a fourth, 1 1/4 cups of diced pear. Fresh pear is always going to be what you want to use. We want to use fresh fruits and vegetables. Next, we're going to add about, and it says here, this is the part that I was kind of concerned about at first. 1 medium scallion. That's a green onion. But what they want you to do is separate the top, the green, from the actual diced onion. Now, the diced onion part from 1 scallion goes in with the pear and the cream cheese. Can you guys see that? Okay. Along with that, we then add 1 1/4 cup of sharp cheddar cheese. The sharp cheddar, if you can find the low-fat sharp cheddar cheese, that's even better. But sometimes it's very difficult to find. The other thing that I used was this one. This was just from Walmart, and that's the sharp cheddar cheese. But if you can find the low-fat sharp cheddar cheese, that's even better. And then it calls for just a pinch of salt. Guys, I'm so excited. If you live here in San Antonio, H-E-B has these little things for measurements, and it doesn't actually measure, but what they say is a dash, a pinch, a smidgen, a tad, and a drop. So this is hilarious to me, and I just thought they were the cutest things. So we're going to add a smidgen of salt. Basically, it's about 1/4 of a teaspoon. And I use kosher salt. We don't want to add a lot of salt because, one, we're trying to keep our recipe low. And we don't want to overpower any of the other flavors that we're using. Now, once we've got our cheese, our cream cheese, our pear, and our onion in here, we're just going to mix this until it's all well blended. Now, the thing I will warn you, you want to try and make sure if you've cut up your pear in advance, it's going to leak some fluid, which means it's got juice, which can make your cheese ball a little runnier if you're not careful. So if you have that extra juice on the pear, you might want to drain that off before you add it. Now, if you're dicing the pear up fresh, you don't have to worry about that. Okay, now I've got that all mixed. as you can probably see. Okay. Now, once it's all mixed like that, it's going to be soft. The consistency is going to be a little mushy. But what you're going to do is you're going to take and you're going to roll this mixture into a ball. And then you would refrigerate it for about 2 hours, which causes it to firm up. But because you guys don't want to hang out with me for the next 2 hours to see this finished, I'm just going to kind of skip that step. Now, the recipe says what you should do is take a piece of parchment paper or wax paper and put it in that to form the ball. I'm not going to do that because I've got on gloves, so I'm just going to scoop it all up and I'm going to form my ball, just like that. Now, once the ball is formed, what you would do would be to refrigerate it in a covered container for about 2 hours, and it would firm up. Once it firms up, then the next thing you're going to do, as you can see here, I've got roasted chopped pecans. So then once it's firm, you're going to just roll the ball into your pecans. Mine's not going to come out as pretty as yours will because your cheese will be firm once it's been refrigerated. And I know this is kind of noisy, I apologize, but I used a tin plate to do this. But this kind of just gives you the idea of what this looks like. And then you have what is a sweet and savory pecan ball. And then you add some of the chives onto it just to add some color. And there you have it. Can y'all see that? Let me get this bowl out of the way so you can see what that's going to look like. And of course, yours is going to be much prettier. But this is a wonderful snack or appetizer that you could take to Christmas, Thanksgiving dinner, New Year's party, and you can take some whole wheat or multi-grain crackers with that. And there you go. Well, thank you again for your attention and your time. And that concludes our presentation. We'll now bring up the recipe for you guys to get. And of course, once this recording has been released, you will have that recipe as your own. Thank you again.